So today we're talking about supporting parents through pregnancy after loss. And pregnancy after loss is, I would say, a very specialized niche, right? Within the maternal or perinatal mental health world, we have loss, a subsection, and then the pregnancy after loss is even smaller. And I know myself, like I am a bereaved mom, and I will tell my story in a second, but that time of being pregnant again after a loss, I thought I was going crazy. And you feel alone when you lose a child, but being pregnant again, it's like the complexity of emotions that are coming up it's so confusing. And when no one's normalizing it for you, you feel that you're crazy. And just so in preparing this presentation, and I talk about pregnancy after loss, but I usually include it in a larger presentation on pregnancy loss. But it was just so amazing to me as a bereaved parent to be able to put language to things that I had experienced, and really understanding that my experience was very common and normal for what I'd been through. But again, with no one to tell me what was normal, it was just feeling like I was crazy. So I'm going to tell you a little bit about myself and my story. So my son Norbert was stillborn at 35 weeks in 2005. So we're coming up on 15 years this year, which I cannot believe. And he had a liver cyst that developed late into the third trimester, was not detected on the 20-week structural anatomy ultrasound. It burst at some point and he died. And the internet wasn't really alive and flourishing like it is now. There was no support. My experience in the hospital was, well, with the OB and the hospital, just nobody gave me any guidance basically. And I had no idea what to expect. I had no idea what to do, how to parent my baby. I didn't know what my options were. Everything seemed really scary because this is the first dead body that I had seen. So I was very, very traumatized. I got pregnant with my daughter 6 months after my loss. It was not planned. I felt like just as I was beginning to come out of my shock and numbness, I found out I was pregnant, and I didn't have a chance to really grieve. Like my grief was halted because then I was pregnant and had to deal with the anxiety that came with pregnancy after loss. So again, like a lot of what I do is because I didn't have a great experience, to say the least. And so I really believe education is empowerment. It's empowerment for healthcare providers to provide better support to grieving parents, but also is empowerment to bereaved parents themselves so they can have like this information and advocate for themselves and know what's possible and what's normal and feel like they're not so alone. So in 2014, the film Return to Zero came out. So this film, my husband wrote, directed, produced as an independent film, and it was based on our story of Norbert, who died. So it's a feature film starring Minnie Driver and Paul Adelstein. And so it's not a documentary, it's like a story. This told the story of a couple who loses their child, the impact it has on them as a couple and in their relations to their community, their family, their friends, like what it does to everybody. So this came out in 2014. Up until that point, we had been very silent and isolated in our grief. We didn't talk about it with anyone really, and trying our best to get along, but when it's just all that grief and trauma is stuck inside of you, you don't do very well. So then when my daughter was born, with the one I got pregnant with after 6 months, I developed severe anxiety and hypervigilance, and I didn't sleep for 10 years after that. And this is not going to be about my mental health, but just like, there was just a lack of knowledge, or there is still a lack of knowledge out there for what this type of trauma can do to you. So the film came out in 2014, and at the same time, the same year, I started hosting retreats for bereaved moms, like weekend retreats. And it's been such a beautiful gift. It's helped me in my healing journey, and then helped so many other women. So we've hosted 16 of these, some of them in Australia and most of them in the United States. And they're a weekend retreat, and we focus on, you know, creating a community among bereaved moms, teaching them that they can have a connection with their baby, and also a lot about nurturing them and them learning about self-care. So out of the retreats came the nonprofit Return to Zero Hope, which became a nonprofit in 2018. And with that, I feel that there's 3 sections. There's supporting bereaved parents, there's, you know, and just all the information for them. The website's amazing. I encourage you to look through the website just for the resources that are on there. For the parents, there's family and friend resources, like what to say, what not to say, how to support grieving families. And then there's a section for providers that has some basic information on loss. We have materials for providers to give to patients, and other stuff in there. We have a YouTube channel. We're doing a webinar series. We're starting a blog. So there's a whole bunch of stuff on there. I will not go into that. We also have a support directory, which I'll talk about later, but you may want to be included on that support directory, and I'll give the link later. But it's a great way for bereaved parents to find resources local to them, which I know at the moment we're not able to do that in person, but still finding people in your state is important. So I'm going to go ahead and share my screen, and we will get started. Hold on. There. Okay. So just looking at what we're going to be covering today, you know, looking at how do we encourage bereaved parents to create a connection to their deceased baby during this pregnancy after loss? How do we help them and support them in creating an attachment to their new baby? And looking at mental health implications in this pregnancy after loss. So what is perinatal loss? And I know that most of you know what this is, but I just want to point out that beyond the miscarriage, stillbirth, or neonatal death, there's all these other, I guess, situations, I'll call it situations, that are pregnancies that can lead to a loss. And being particularly aware that terminations for, you know, terminations in general are a loss. And then when you're looking at terminations for medical reasons, understanding that when these parents find out that something is wrong with their baby, they receive these results back, there is an emotional similarity to learning that your baby's died, you know, and it's, even though it is a decision to terminate, it's not really a decision. It's not like, it's a wanted pregnancy. And so just being aware that there are different situations that we're looking at other than just the typical ones. And I say here, 1 in 4 women experience pregnancy and infant loss. And the number is actually, Catherine Gold has an article that says it could be up to 1 in 2 women experience pregnancy loss. So the numbers might just be higher than we're aware, because maybe we're not counting everything, people aren't reporting. So just being aware of that. I just want to really remind you the importance of validating all losses, no matter what type of loss, no matter how long a woman is pregnant. People transition into their role of parents during pregnancy. They become attached to their baby during pregnancy. They become a mother and father during pregnancy. And so when their baby dies and they don't have a baby, a live baby with them, they are still mothers and fathers. And I think it's important to call them that and acknowledge that part of them. You may not know how many losses they've had, like the importance of taking the loss history, like what other losses have they had? What did they have to do to get pregnant? Like, it's not just, oh, this is really common, you can try again. Really giving them a safe space to feel their feelings and be in their grief. Okay, looking at perinatal loss and mental health. So we're just going to look at quickly at mental health after perinatal loss, not in the subsequent pregnancy yet. So these are some common themes that we see among bereaved parents that come up. So I'd say, like, in the self-blame and shame and guilt area, there's asking the question, what did I do wrong? Did I eat that hot dog? Was it because I went on that airplane ride? Was it because I didn't take my vitamins? Things like that. There's a lot of questioning. The anger towards healthcare providers, right? Because I hear a lot of women know that something's wrong with their body and they are not necessarily validated and acknowledged for that. And then the baby dies. And so there can be a lot of anger. And then avoidance of healthcare providers associated with their loss. And this can lead to people wanting to change providers when they when they get pregnant again. And that's common. So with mental health and perinatal loss, it's complex because we have grief because somebody, right, their baby's died. It has been a traumatic event, most likely, because their baby's died, whether it's inside of them or afterwards, it's traumatic. So there's symptoms of PTSD. And there's all the perinatal mood and anxiety disorders that come up because they have had a baby, even though their baby's not alive. So the statistics are bereaved mothers are 4 times as likely to develop symptoms of depression and 7 times as likely to develop symptoms of PTSD than non-bereaved mothers. So just keeping this in mind in general. This is the mental health situation. It's complicated. I don't necessarily think that it's essential to tease out what the diagnosis is here in terms of, like, there's so many overlapping symptoms, but just knowing that they're all coexisting is important. And then now looking at pregnancy after loss, what does this look like? So between 50 and 80% of women who have experienced pregnancy loss will become pregnant again. That's a lot of people. There's a lot of people that will become pregnant again. So that's why it's really important that we're talking about this. And having a subsequent healthy pregnancy and birth does not resolve the mental health problems that came or resurfaced as a result of this pregnancy loss, the prior pregnancy loss, right? And that pregnancy loss is a risk factor for mental health issues coming up. So being pregnant again is the biggest reminder of their loss. This pregnancy this new pregnancy is a traumatic experience for them. You know, they have lost their innocence. There may be self-blame for their loss. They don't feel they can keep their baby safe. They don't feel that there's a sense of control. And they are that statistic, right? There's no certainty. And so they're pregnant again, the trauma is resurfacing. I just want to make sure. I think someone may have put something in the chat box. Let me see if I can get this. Okay, I'm going to keep the chat over here. Wait, I'm sorry. I did not actually mean to do that. Okay, so then someone asked me about suicide data. I don't have suicide data. So I don't have that. And I can look. I didn't remember seeing anything specific, but I will follow up on that and I'll make a note of that. So acknowledging that this time is filled with complex and duality of emotions, right? We have on one hand, anxiety and fear, right? Because we don't know if we can have a live baby. And on the other hand, there is that hope and excitement that maybe I will get a live baby. And it's normal to have both. But because we're having both, it's difficult. It's a difficult time to navigate because we're going to talk more about this, but like dancing between the two and holding space for both of them at the same time. So this is a video that can be found on the YouTube channel that is Allison's talking about preparing for having another baby after her loss.
Something that I immediately focused on after my cycle came back, to be honest, was trying to get pregnant again and planning for it. I found the resource Pregnancy After Loss Support. It's a website, and I just scoured the page and read all the articles, just trying to equip myself with those tools because I knew how much anxiety would be part of subsequent pregnancies. And at this point, I didn't even know if we could get pregnant again because Amelia was our first child, so I had no track record of having a healthy pregnancy. I had to just really get some tools to be okay with trying again. But honestly, the focus I was able to put into that and the energy just helped me channel just myself into something positive and thinking about a subsequent child that could join our family and trying to put as much optimism as I could into that hope.
So in this new pregnancy, looking at the relationship to the child, like this child, there's the concept of the vulnerable child syndrome. Could be like an overprotection of this baby that could lead to separation and individualization issues as time goes on. There's the replacement child syndrome where the new baby is trying to replace the old baby. Sometimes you see that the new coming baby is the baby that died, like the same soul is coming through again. There could be coolness towards the unborn baby, like a lack of attachment. And there could also be just overprotection and hypervigilance with this new baby and subsequent children. Like this is all common. So sometimes The new pregnancy may help lessen grief reactions. Okay, sometimes, but the grief is not resolved. The new baby can never replace the old baby, you know, the one that died. So I think that's really important to understand, right? Is that it's not going to take away the pain. It might lessen the pain, but it's not solving any problems. And grief and attachment have to happen simultaneously. Like that's what I said, right? The complexity of these emotions that are so separate, and being able to grieve the loss of your baby and have hope and attachment and excitement towards the new baby. The other thing that I see a lot, and I know that I experienced this myself, is that parents feeling responsible to be sad. So that pain and sadness is their connection to their baby that died. And if they lessen that and they let go of it, they may forget their child. They may not be connected to their child. And then if they're pregnant again, if they direct their attention to the new baby, it's like they're abandoning the deceased baby. This is very, very common. And we need to normalize all of this and also create the connection in their mind that these babies are siblings, that it doesn't have to be one or the other, but they're both these parents' babies. They're siblings and they have to coexist together. So this scene is from Return to Zero, the movie, and this is Maggie, the lead, and she has had her loss, and she's talking about this pain that I just described. So we'll go ahead and play this.
It's the most beautiful hour of my life. I didn't want it to end. You know, it's strange, this pain I feel. I love it. I love it. And I embrace it. I'm afraid if I let it go, I'm gonna lose the last little piece of him I still have. So funny, this thing no one tells you about the relationship that begins with them after they die. If I can quiet my head down enough, I can feel him. I hear him.
So with that, I just wanted to show you, not just me talking, right? Like how this comes across, the importance of normalizing it and encouraging these bereaved parents that they can have that relationship with their deceased baby. It's important. So the next thing I'm going to talk about is just results from 3 focus groups that had 21 women between them, and the range of losses were from within the past year to 34 years ago. And what were themes that emerged? So the first one is dealing with uncertainty in the pregnancy. So some women wanted to be very present in their pregnancy and enjoy the time because they aren't, you know, it was safer to stay pregnant for them, right? They didn't know what's going to happen as time went on, and it was time for their baby to be born. Other women want to get through the pregnancy as quickly as possible and just get their baby out alive and healthy. So these are different, but they both come up. For some people, there's a sense of accomplishment and feeling a little bit safer if they can pass the gestational stage of their previous loss, but not everyone. But each day is survival, like mentally surviving the day, living in uncertainty. And instead of being pregnant and expect that you're going to get a baby, you know, that isn't what they're dealing with anymore. They don't know what's going to happen. So it's a scary and uncertain time. And then wondering if the baby is healthy. So, right, like every day worrying, like, is my baby okay? Is my baby alive? Are they not moving the same as they were? And being hyper vigilant to the baby's movements, behaviors. And then also a heightened concern emerges around the time that their previous loss was. A lot of that is grief that's stored in your body, but also, you know, mentally, like, is something going to happen at the same time? There's waiting to lose the baby. So that, like, waiting for the other shoe to drop, knowing that there's always a chance that something bad can happen. There's no guarantee that they're going to get their live baby. They know this, right? They lost their innocence, and so they're afraid. So that's kind of always looming in the back of their mind. Holding back their emotions. So avoiding full emotional investment in their pregnancy, refusing or postponing telling other people about their pregnancy, not setting up the nursery, being in denial of the pregnancy, keeping busy, right? If we just keep occupied, I mean, that sometimes is a positive coping mechanism, because you can't just sit there being worried all the time. So what can you do? But just, I guess, in balance, we try to do that. I remember with myself, like, I did not want other people to know. And I wore this green sweatshirt as long as I could because it was a little baggy and I would just want to hide. Like, I don't want to talk about it. I didn't want people to ask me, is this your first baby? Because my loss was my first. And so I didn't have a live baby, and I didn't want to go into explaining the situation. So, excuse me, acknowledging that the loss happened and it can happen again. So helpful responses, like women reported what was helpful, acknowledgement that they had a previous loss. It was helpful to talk about their deceased baby. It was helpful for them to receive encouragement to come into the office or make a telephone call if they were worried. You know, whatever they needed to receive reassurance. It was helpful for them if their providers legitimized and validated their fears, and let them know that they were being heard. That was all helpful. You know, unhelpful responses, whether it's from providers or family and friends, would be, at least you can get pregnant, or God has a plan, or God wanted another angel, or, oh, you can have fun trying again. When their feelings are not validated, it can lead to a lot of isolation. It can feel like they're burdening other people if they're talking about what's going on with them. And so we really, as a culture, need to create a safer space for grieving any loss, but especially the loss of a baby. And on the Return to Zero website, we have the section for family and friends, and it has do's and don'ts of, like, what to say and what not to say after a loss, as well as suggestions for how to support parents going through this. So I know that that's been helpful, I mean, for people to listen to or read. It's not, there is some videos on the YouTube channel as well. And then just normalizing that it's difficult forming an attachment to this new baby. So definitely in my case, delayed or interrupted grieving, right? Like, I had just come out of my shock and then I got pregnant, and I didn't have time to process any bit of my loss. And right, and so it's almost like that had to stop, be put aside, the grieving, and then I had to be like in my pregnancy. There's a denial of the pregnancy. There's a fear of attachment because you're fearing another loss. There's increase in anxiety for sure. And then emotional cushioning, which I'm going to talk about. But just knowing this is all common, and normalizing this for your patients is really important. That's what you can do. But it's important for you to know that it's common first, right? If we don't know what's common and what's not common, then we're not able to do that. So emotional cushioning, like I would talk about this all the time. I was aware that I was doing this. I didn't know that it had a name. And so when I learned that it had a name, it was such like an aha moment to me, like, wow, I can put language to what I'm feeling. So this is normal and adaptive. It's in a way that we're coping with our anxiety, our uncertainty, and our sense of vulnerability during this time in subsequent pregnancies. So just as I was aware, other women are aware that they're doing this because they're fearing the loss of their baby. They're trying to protect themselves. They're trying to protect others. They don't want to disappoint other people. A lot of times we'll see they're strong on the outside, like I'm fine, I'm okay. And then inside they're not. And it's like they're living this duality of external self versus internal self. And that can be very stressful. But what does emotional cushioning look like? So it can be conscious or subconscious, and it's a complex emotional self-protective mechanism. So it's avoiding prenatal bonding and attachment with this new baby, holding back their emotions, their excitement, they're lowering their expectations, right? Like, I don't know if the baby's going to be alive. If I don't attach and the baby dies, maybe it won't hurt so much. Like, that was my thinking. There's a delay in telling other people about the pregnancy and not making physical preparations for the baby at home. So not setting up the nursery, not buying clothes, diapers, decorations, right? Because in the first pregnancy, they probably did all that. Depending when the loss was, but like buying things, setting up a nursery, having a baby shower, and then the baby died, and then having to deal with all that stuff. And so this time it's like, I'm going to do everything differently. I'm not going to prepare at all because there's no certainty that I will bring a baby home. So if that makes some sense. So research on emotional cushioning. So in a study of 63 women during pregnancy and postpartum, these women had all had losses. The majority of them report some type of emotional cushioning. So they were answering questions related to holding back their emotions during pregnancy, and that the emotional cushioning questionings were significantly and positively correlated with pregnancy anxiety. So if they're having anxiety, this is one of the ways that they're coping. Next is being aware of triggering events. So this could be important for you to know. Medical appointments and procedures can be triggering, whether it's an OB appointment, as a follow-up, a new baby appointment, or any doctor or hospital visit can be a trigger. Then we have things like birthdays and anniversaries of the deceased baby, baby showers for themselves or for other people, holidays. They're all triggering events. So you can help by educating parents that these could be triggering, help them to plan for them and to allow them permission to opt out when possible, or to have a plan that if they're in a situation that is not okay, that they have a plan to get out. So if they can't opt out, or they're not opting out totally, like, I'm not going to go to this baby shower, then at least saying, like, if you go to the baby shower and you get activated, and you need to leave, how are you going to get out of there? So I think that's really important, because feeling trapped in the situation, it can lead to all just sorts of more trauma coming up. And I'm going to talk a little bit about the trauma of an ultrasound. So recognizing that it's impossible to repeat the experience of prenatal care and being pregnant without stimulating painful past memories. Like, grief and symptoms of PTSD are going to resurface. This is true for both men and women, and especially if the death of the baby was diagnosed by an ultrasound exam. The trauma is imprinted through all of their senses, and doing this again is going to trigger that trauma. So, you know, there is a possibility of, you know, feeling out of control and feeling that their feelings are out of control, right? That they don't have control over that. And they're afraid that, you know, they're going to go into the situation and they're not going to be able to find a heartbeat, and that their baby's dead and they're just waiting for that bad news. So it's a really important, I would think, to, you know, number one, if they need, figure out what they need. Do they need to see their baby's heartbeat and the baby's movement on the screen, and communicate that ahead of time with the person performing the ultrasound? What else do they need, and can they ask for it? And this quote is from Joanne O'Leary, but it's very similar to Cheryl Beck's work. It is the subjective perception of the trauma that's more important in the development of symptoms of PTSD, right? The trauma is in the eye of the beholder, and just remembering that, and helping them to understand that, the parents. So how can you help parents better prepare for a procedure that might be triggering? So number one, acknowledging that their loss is affecting their current pregnancy and their current mental health. Help parents to process their past grief by bringing feelings to a conscious level. So if we can rename things and give language to it, it has sometimes decreases the power. And again, linking and establishing the babies, the deceased baby and the new baby, as siblings. That's very important. And then, do they have any unresolved questions related to their previous loss, like medical questions? And can you help them in getting those answered? And then preparing parents for, you know, just saying, like, these past memories may come up in this situation, and just saying, this is really common to have flashbacks. It's common. So I think looking at ways, can we give parents a sense of control in the experience? So this is like, how can we decrease triggers for them? You know, so sometimes in a doctor's office, we can do things like requesting appointments at certain times. It can be, can we have an, you know, I need an appointment where I'm not going to see other pregnant people. It's too triggering for me. So can it be at the beginning of the day, immediately after lunch, or at the end of the day? And talking with the office staff and seeing if that's possible. Another option, they come in, they get put into their own private room right away, so they don't have to wait in the waiting room. That's really, you know, there's things that a clinic or a doctor's office can do to make it a less triggering experience for parents. And also the idea that, right, when we're under stress, our brain cannot remember. So as providers, the need to repeat yourself, you know, more than saying things once, so that the parents can really hear things, giving things in writing to parents so they can follow up later, encouraging them to contact you. You know, do they have your number that they can reach you at? they can bring someone with them to an appointment. Maybe that can help with remembering information, or maybe they record it on their phone, what you're saying, or what whoever the provider is saying, so that they can listen to that again. And then debrief the experience with them. So depending what your role is, but helping them to process and understand what went on. You know, what went on, like, actually happened, and then what happened on an emotional level for them, and just helping them work through what came up and what needs to be processed. So passing this gestational stage of loss. So for some people, going beyond this gestational stage of loss, of their prior loss in the current pregnancy, it may reassure them and may help them calm down a little bit, decrease anxiety, have hope and excitement for the future, and encourage more attachment to their baby. It may not. And I would say this is true more so for people who had earlier losses and for people who have terminated for medical reasons, knowing that, right, that their baby doesn't have the same genetic anomaly or physical anomaly that their previous baby had. And they can kind of have a sigh of relief and start to become attached. But when you have a stillbirth, there's really no relaxing until your baby comes out healthy and alive. So this is just, sometimes this is accurate. This scene next is after Maggie has given birth to her subsequent healthy baby. She's in the hospital, and it illustrates the detachment and the numbing to this new baby that sometimes comes around. And it's a really complex situation. So this is really for me, one of the saddest scenes in the movie, because, right, we all think that once we have a happy, healthy baby, we should be happy and fulfilled and everything should be fine, but it's not always the case. It's complex.
Have a perfectly healthy, beautiful little baby girl. What's wrong?
I don't feel how I thought I would. I'm not happy. I'm not sad. I don't really feel anything.
I know.
What about joy? When does that come?
In time.
I think I'm gonna be a terrible mother.
Not possible. Not with everything you've been through.
Thank you for everything.
You're welcome.
So again, here, just trying to normalize for you what can be a common reaction that's maybe not always seen externally, but it can be going on. Just checking in with parents and allowing them the space to feel this way if that's how they're feeling. So looking at supporting parents through this time. I mean, I've talked about some things, but this is a little bit more concrete. So family and friends, and I don't think we have a lot of family and friends here, but I just created this slide because I think that there needs to be education of family and friends, and that we live in a society that's very uncomfortable with death, especially the death of the baby. No one knows what to do or say. And so people need guidance. So understanding that this, you know, for other people to understand that the new baby does not replace the baby that died. The new baby will not heal the parents and solve all the problems. And it's important that they validate continued bonds between the parents and the deceased child, and to remember and honor the deceased child. Let me quickly just look. Okay, I will answer a question at the end. Okay. And again, education is such a big piece. And you may be in the position to do that with the family and friends, and you may have to tell the parents that they may need to do that, unfortunately. Okay, so responsive care. So I think it's really important that we're not, as providers, we're not saying everything's gonna be okay, because it invalidates their feelings and it makes them feel unseen. We need to take their concerns seriously. We need to be responsive to their concerns and their needs. So we do this by discussing previous losses. We ask them what would be helpful to them. And maybe they don't know, and that's why we have to keep asking, give suggestions, give them choices. I think giving them small choices where possible would be a great way to help them have control in a situation where they don't have a lot of control. And then encouraging them and giving them permission to reach out when they have questions, when they need reassurance. And that's really important, to not feel that they're a burden to you or to the provider. And if they have a provider who's treating them as if they're being a burden, then they need to switch to a different provider who will help provide emotional support through this time. So as a provider, you can help by including the deceased baby in this pregnancy after a loss. So calling the deceased baby by his or her name, knowing the gestational ages, stages, and anniversary dates of the previous losses, holding space for parents to process their unresolved grief. I mean, this depends what your role as a provider is, and just take what is applicable to your role. But, you know, if you're more in the therapy role, it's allowing them to process their unresolved grief, allowing opportunities to create and give meaning to their loss experience. How can you facilitate a connection to the baby that died? But all of us can connect the deceased baby to the live baby as siblings, right? That they are a family union. And then giving them permission to not be sad, that it's okay if they're not sad. And then through this, they can still have this connection to their baby. That they don't have to have that connection through their sadness and pain. So what are ways to create a connection to the deceased baby? So just knowing that the attachment a parent has to their baby is formed during pregnancy, you know, and it isn't only when the baby's born alive. And so even though their baby's not alive, they can still have a connection. It just looks a little bit different. So these are just ideas, talking or writing to their baby, photos of their baby in their home. Maybe there's a sacred area in their home that they set up that has special objects, pictures, that type of stuff. A lot of times nature is helpful. Maybe they'll wear a piece of jewelry with their baby's name, initial, or their birthstone. Just different things that they can do. And they may need ideas because they don't know what's normal or what to do. Like, none of us has been through this before. And that's why we have to really rely on people who have been through it to get ideas. And this stuff is on the Return to Zero Hope website as well. So the attachment to the new baby. Really, parents may need encouragement to form an attachment. I remember I was pregnant with my third pregnancy, and I was 8 months pregnant, and my doula, who didn't understand loss at all, but she did say, she's like, you're going to have a baby. You need to talk to your baby. And I just said, you don't know that I'm going to have a baby, right? So she needed to say that in a way that I know that this is really hard. And I know that there's no guarantee that you're going to have a life baby, but this is a different pregnancy. This is a different baby, and this is a different outcome. And how can you form that different special attachment to this baby? So, right, acknowledging it, but then giving them permission to do so. And then also empowering parents, right? Like, continue to check in with them over time. They may put on a good face for other people, that they're struggling inside, and emotions change over time. They might be doing okay at one point and not so good at a different point, and really just giving them opportunities to share where they are and how they're feeling. And then how can we help them have a sense of control? As I said before, small choices can help in this. Advocating for themselves and asking for what they need is a way that they can feel empowered. And then also creating a birth plan. So I have a little video about the birth plan, just talking about how the birth will be different, right? Because this birth, again, there's a loss of innocence, and there is no guarantee that the baby will be born alive. And so what do they want this to look like? How do they want to involve other people in their family or community? Who do they want in the room? How do they want to include their deceased child in this process?
Having a pregnancy after loss can mean very different things to everybody. There's no one size fits all with how a person will react to that pregnancy. Some people are hyper attached to that baby, and some people are super detached from that baby. Once again, there's no right or wrong, it just is. Pregnancy after loss can feel really terrifying. And so it's really important, especially as you near delivery, that you have your birth plan, like your actual birth plan as you would with any other pregnancy, but really a specialized birth plan that you've discussed with your care provider so that you know exactly what you're walking into. Some things to include on that are you going to participate in a birth class? Will it be a traditional birth class with other families? Do you need more individualized care? Previewing the hospital, discussing, do you want a different room than what you had before? But some families want the same room to create a more positive memory or to have, some attachment to their baby that has passed away. Pain management, every pregnancy and every delivery is different. But it's important to revisit that choice every time. Walking into a hospital when you're in labor can feel very terrifying. You're reliving an experience you already had, most likely, and you need to decide what kind of physical pain are you capable of holding, along with the emotional experience that you will be having. Visitors is also really important. So the support that you have while you're in labor, who do you want in the hospital room with you? Will you have family? Will you have a mother or mother-in-law, a trusted, doula or midwife? Or do you want it very private, you know, just you and your partner, or you and a birth coach? Also, visitors after the baby is born. You know, when you lose a baby, your whole community really does grieve with you. They mourn that loss for you. If they could, they would take that pain away. And so when the birth of another baby comes, without understanding, many times they think you're going to be okay now. They don't realize all of the extra emotions that go with that. And so knowing if you're ready to have visitors to meet that baby is something that needs to be considered. And it's important to discuss all those things with your OB. It's important to discuss those things with the nurses on duty so that they can act as kind of, you know, the middle person between a person coming up to check in to postpartum to visit with you, and they can, you know, either prep that person for what to expect or say, you know, I'm really sorry they're not accepting visitors at this time, and allow them to carry that so that you don't have to. Your job when you have a baby is to bond with your baby and to be present in that moment. You don't have to worry about what the other people, you know, are wanting to have happen. So it's really important to have these discussions. It's important to think about them before you're in the moment. It's also okay that when you have a birth plan, my OB called it a birth wish. You know, we want things to go a certain way, but we have to be flexible to know that, number one, we can't control everything, but number two, sometimes our decisions change when we're in the moment. What you think you might want might be different when it comes down to it. So it's important just to start thinking about those things and having that conversation so that you at least have a framework for what to expect.
That had a lot of good information in it. Okay, here's another, hopefully this is a little bit shorter video. This is a scene from the film after Maggie's had the subsequent baby. And it's illustrating the making that connection of siblings between the two babies.
Hi, baby. I know, I'm your mama. Tough break. I know. I want to tell you about someone. Yeah. His name's Arthur. Yeah, he's your big brother. Guess what? He's gonna be watching over you forever. Keeping you out of trouble. Making sure we're together for a long time. Ah, yeah. Long time. You sweetie pie. Hi, sweetie pie. You're so pretty.
Okay, so that was a little bit more positive, but right, it's complex. It is complex. So last thing we're gonna look at is mental health in pregnancy after loss. I'm gonna try to get through this in 10 minutes, and then after that, we can open it up to questions. So, acknowledging that loss, perinatal loss, is a risk factor for mental health complications in subsequent pregnancies. And also, as you probably know, individual mental health and personality pre-loss is the strongest predictor of chronic grief. So just knowing, like, being aware of what was the mental health picture before the loss. They had a loss and then now they're pregnant again. But in addition to mental health complications that are coming up, there's an added risk for poor fetal outcomes during a subsequent pregnancy. I mean, because, sorry, I'm reading that wrong. But because of mental health existence of mental health problems, there's higher chance of, you know, another loss, and it can negatively impact the attachment to the subsequent child, which I'm sure, like, right, we talked about that. There's a lack of attachment, and that parents' unresolved grief predicts children's disorganized attachment. So again, just knowing that parents' mental health impacts infant and child mental health. And that's why it's important that we're doing this work, that we're understanding this. So with stillbirth, this is information specific to stillbirth. So subsequent pregnancies and stillbirth, significantly more depression in the third trimester and more PTSD symptoms in the third trimester. And there's higher anxiety if the conception of the subsequent pregnancy occurred within a year of stillbirth. So it's almost like people wanting to get pregnant, to have a live baby, but they haven't processed their loss and the grief and trauma surrounding that loss yet. And then anxiety in the subsequent pregnancy may be related to the degree of personhood a mother assigns to her dead baby rather than weeks gestation. So referring to the baby who died as a baby, my baby loss, my baby died, rather than a pregnancy loss or a fetal death. You know, if they are assigning personhood to it, there's more attachment, and it's not related to the gestation. It's what each person's attachment level is. So this varies between person and person, between dad and mom, or birthing parent and non-birthing parent. Just looking a little bit more, we're seeing anxiety, distressed, depressed women. But on a positive note, women who had a loss but received intervention, like therapeutic counseling intervention in the postpartum period, had similar scores on the BDI to women who did not have a loss. So it's showing the importance of intervention, of helping give professional support to these, women in this study's case, but to parents. And then in another study, it's talking about, with a prior pregnancy loss, you're twice as likely to be diagnosed with major depression in the subsequent pregnancy. If you've had multiple pregnancies, you're more likely to be diagnosed with major depression or PTSD. And that the type of loss did not affect the risk for depression. So again, validating all losses. It is more on an individual level how the loss is going to impact a person. So in this study by Barr, it showed that there was a decrease in active grief if the woman was pregnant, had a live baby, or volitionally deferred pregnancy, okay? So the decrease in active grief. There's sustained active grief if the parent was trying to conceive but was not pregnant. So they're dealing with post-bereavement and fertility. I thought that was really an interesting study. It's just looking at, and this is not saying that the grief goes away and the trauma goes away. It does not go away. It's just in those situations, I think, where they're feeling more in control and more positive things happening, it's just lessening those symptoms a little bit. And then looking at fathers. So first, I just want to say that there's not a lot of studies about pregnancy after loss in general. There's even less studies looking at fathers in subsequent pregnancies. Also, the full range of men's grief reactions may not be tapped, because the measurements of grief that we're using focus more on feminine emotions of loss. And so they're not accurate, they're not asking the right questions. And fathers are never asked how they're doing. A lot of times people ask how the mom is doing. We'll ask him how the mom's doing, but we'll not ask how he's doing. But just in the research that I've done, you know, so dads who saw the baby on the ultrasound or heard the heartbeat, they express more of a sense of loss for the baby that died, and they're more invested in the subsequent pregnancy. Here, these articles said, like, the men and women, you know, the emotional experience may not differ from each other. They are both susceptible to developing PTSD, but they may be keeping their feelings of worry and their stress level away from their partner to be the strong one in the family. And but that a lot of times leads to unresolved grief, anxiety, but they are fearing this bad outcome, and they're equally as traumatized during, you know, a medical procedure such as an ultrasound. Like, they're scared too. So looking at ways that we can help patients cultivate mental wellness, creating meaning, so making sense and of their loss, integrating this experience into their story, their journey, encouraging ongoing bonds with their deceased child, like how can they keep that connection. Ritual has been important. We do that at the retreats, but rituals like candle lighting, saying a prayer, going to the cemetery, things like that can help with this creating meaning and making sense of it. Social support from family and friends is important. You know, as I mentioned, having validation and from validation in, you know, having the parents having their emotions and their connection to their deceased baby. And then support groups can be so helpful. A support group for pregnancy loss. There are some support groups for pregnancy after loss as well. I have a website, the Pregnancy After Loss Support Organization can be helpful in finding those. Yoga and meditation is helpful. Nature is helpful. So those are all things that have been shown to kind of decrease stress, decrease depression, increase self-compassion. And then referring out for support. So it's really important that as a provider that you're able to detect when you need to refer out for support, and you're able to direct patients, parents, where they can find other providers who are skilled and educated in perinatal mental health and perinatal loss as well. So can you create a local list, like have a little insert that you create to give them, like something you print out, can change over time, be like, these are local resources. Or if they're not, you know, including websites for other resources. It can be Pregnancy After Loss Support, Return to Zero Hope has a support pregnancy loss directory on there. And so giving them that information as well. So here's our directory. We have support broken up into different types of support. Individual, which is usually will be counseling and psychiatry. Sometimes there's acupuncture in there, and bereavement doulas. Local support groups, or support organizations. So both of those are by city and state. And then there's also national organizations. So that's helpful. If you want to be included on the directory as a provider or a group that you offer, if you go to that page and scroll down, there's a form that you can fill out to be included. And we'd love to have you, because obviously I don't have everything on there, and we want to be able to connect people to resources. On the Return to Zero Hope website, we also have a web page dedicated to pregnancy after loss, which could be helpful for you, for patients. And this is under the parents section of the website. And then also I mentioned pregnancy after loss support. So I believe they have online groups, but they have a ton of information and articles that can be really helpful for parents. And there's also a list of citations for providers as well, if you want to go and read more articles on this. So there's my name and my email address. And then there are references which will be included in the PowerPoint. I'm going to stop the share and then we can open up the chat box and have a little chat. And I know that it's 11:15, so we can talk as long as you want. If you want to type something in here but you can't stay, I can answer it, or you can send me an email and I'm happy to answer a question as well. So however I can help you. I'll stay on for like 15 more minutes if people want to talk. So Sabrina asked the question, what role did the woman play for the main character in the movie? So she was the OB for the subsequent pregnancy. She had had a loss herself. And this character was based on my experience that I did find an OB. I didn't know she had had a loss, but she had had a loss and she shared that with me. And she was just really such an amazing emotional support for me going through that subsequent. She was with me for my second and third pregnancy. So both of my living children. And I needed that. Like, even, come in every week. You can get an ultrasound, whatever I needed. She understood what it was like. So yeah, I was lucky, and she plays a beautiful role in that movie. So that is that. Okay, Kirsten, recommendations for methods on how to facilitate a connection to the deceased baby. I think that I answered that, but Kirsten, if you want to know more, will you write more specifically what you want to know? And Taylor is asking, as a mental health provider, how will I know when I've had enough training to work with this population? So how to answer that? I mean, I think that it's hard to get information out there. And I don't know if you are talking about pregnancy after loss specifically, or just pregnancy loss. Could you clarify that, Taylor? And while you're doing that, there's one Q&A. Okay, hold on. So Taylor's saying both populations. Okay, so, PSI, I took their certificate training and just took the certification exam. They don't cover this in depth. There is an organization, Pregnancy Loss and Infant Death Alliance, that has a conference every 2 years, which is good, but it's not as focused for mental health providers. But it's still probably the only thing out there that addresses this. In the meantime, it's like, go to our website, read everything, read everything in the parent section. And I think that will really help you get a better understanding of what the parent's experience is like. Join our webinars, whether it's for a bereaved parent or for providers. And I think once you understand what's normal, then you can start feeling more comfortable working with this population. And the pregnancy after loss, I would say go to the pregnancy after loss support website and read, just reading. But I think you don't need to, you don't need to go and print all these articles. Like what I said in the presentation is fine enough. And if there's something you want to look into further, you can find the articles that address that specific theme. So Jennifer is asking me, am I able to? Yeah, I am totally able to travel. Well, not at the moment, I can't travel. Obviously, right? Like I'm in LA where lockdown is still happening through the end of July now. But I can do things via Zoom webinar, like a video conferencing. I've done that with hospitals before, and I totally can travel once we can travel again. Yeah. Catherine sent me a question that says, she's a therapist. Yeah, do I use a template for gathering information and screening mental health when supporting a couple who have experienced a perinatal loss? Well, I have something I created myself. I don't, yeah, so I sort of do. That's probably too much to put here. And it's not in a format that I can share yet. So what I'll say is, Catherine, if you'll email me, I will just do this. And I'll give some ideas. Okay, just email, because it'll help me remember what I need to do. Okay. Okay, Marianne says graduate work in thanatology provides a deeper awareness of the grief work journey. Yes, I know, I would like to study that more. Danielle, I was putting my newborn down and I may have missed information on the provider list. Yes, it is available online. So it's rtzhope.org/support is the directory. You can find it on the website there. Barbara, thank you. Thank you, Barbara, for your thank you. Marie is asking, any thoughts on running a group while pregnant? Meaning for people, I need a little clarification. People who, sorry, my throat is very dry. I need clarification. So are you asking about if the therapist is pregnant and running a support group for pregnancy loss? Yeah, that is hard because it's going to be triggering to the women attending. I mean, I think that's that's something that you have to be really upfront with the people in the group. I don't think it's the greatest idea unless you've been through a pregnancy loss. And if you've been through a pregnancy loss, then I think that's your connection. But if you haven't been, then I think it's really, it just could be too triggering, you know. That's just my honest answer. Sorry for all the coughing. It's all the talking and I'm sucking on something now. If there's anything else, I mean, I'm happy to sit on here for a few more minutes, but you can, I will send the link to the recording out. I'll send the PDF of the PowerPoint. And if there's any other questions, email me. If there's any suggestions of, like, also just as providers, what you want to hear more of, let me know, because like I'm feeling that we're able to do a lot more of these webinars, and they can be helpful because there's not a lot of educational information out there for providers. And so what do you need? And that would be helpful for me and my team. Yeah, so I will send out a link to the recording from the webinar after we're done. Okay, so I think there's no more questions. Thank you all for being here, for staying on. I know I went a little bit over time, but it's good information and really, really important. So reach out to me, join our directory. We have beautiful brochures that we will send out a sample packet, and you can request that online as well. So I'll try to put this in the email that I send out, so you don't have to remember what I'm saying. But okay, be safe, everyone, and thank you again so much for being here, and thank you for the work that you do. Okay, bye. Or maybe not bye. Okay.